So how will you do the egg freezing and thawing in the laboratory now, ma'am, as of now?
So egg freezings also, there is a protocol, specific protocols we have. With the Cretazato, what we use, while standardized medias, what we use, with that some protocols is that within 1 to 15 minutes only we will do that. We do the freezings, egg freezings or embryo freezing. Oocyte freezing has a different timings, and embryo freezing has a different timings.
The doctor drawing the eggs, so 1 to 20 eggs might come. So how do you grade them? So which one can be able to make up to the 5th day embryo?
There is not a specific. When we do ICSI, we see the only polar body, that is a mature oocytes. In that only we in one egg we inject the sperms. Only immature oocytes we don't inject, abnormal oocytes we don't inject. And once the ICSI is done, the second day when the FERT is done, polar body, two PBs are seen, then only we will have an idea that this might yield for the embryos or blast. But till means on day 3 also, if the symmetry is good, everything is good, then only it will yield for a blast.
So ma'am, not every case you have done might be positive, some cases might be negative. So how do you take them, and what are the steps you need to prevent, so next time you need to make them positive?
It is a good question actually. So once the first cycle is failed, so whenever the patient come for the second cycle, so we as of I know that this is the second cycle of the patient, just I will go the previous history, I will see how the oocyte quality was there, how the sperm quality was there, that time what we have used the means technology. Some patients we don't use in first cycle. If the patient's count motility is good, morphology is okay, we don't use the technology, means Zymote or CO0 we will not use, but we'll feel that we take the good sperms only, but there will be genomic factors also. So if they come for the second cycle, so if the patient does not opt for this, then we will tell the patient that there is a next advanced technology that we will use this device for you for the sperm selection, and we will do the ICSI. So patient will agree for this, and because anyhow patient's second cycle, so we will use that procedure, and we will try to give our best.
So ma'am, what are the basic investigations you recommend to the patients before going into these treatments?
Investigation is all consultant only will take, means AMH, how it is AMH, FSH and P4 and everything is checked. And when the patients come to us, we see all history. We have an embryo sheet, we write all history, we see how the follicles are, we see the E2 levels, means if the E2 levels is 3000, so per follicle is 300 we calculate, means if E2 levels are more, how much follicle we are expecting, because when ma'am scan we will take 14 above, 15 above only follicles, but we'll see the E2 levels. If E2 levels are, we know each follicle says 300, so in that way we'll calculate, and we will see prepare the medias, dish preparation is done.